If you're 60 or older, there's one surprising habit that might be healthy looking, but quietly raises your stroke risk, particularly in your sleep. No pain in the chest, no feeling dizzy, no warning. You're fine one night, then wake up the next morning with your arm immobilized, unable to speak well or even stand up. As a brain doctor, I've seen far too many older adults suffer devastating strokes, not because of smoking, not due to high cholesterol, but because of something they genuinely believed was good for them: walking. Yes, walking. Done incorrectly at the wrong time, or without taking a few specific precautions, walking can peacefully interfere with circulation, promote blood clots, and lay the groundwork for a stroke during your most susceptible periods, between the hours of 2 a.m. and 6 a.m. In this video, I'm going to expose 9 typical walking errors that have done severe damage in older adults, even those that appeared totally healthy. I'm also going to give you real-life examples of patients who believed they were doing everything correctly, until a single walk altered their lives forever. If your brain, your autonomy, or your loved one matters to you, don't skip this. And before we start, don't forget to click the subscribe button and hit the notification bell, so you never miss another health hack created especially for you. If this video proves useful, leave a 1 below. If not, write 0 to inform me how I can make future content better. Mistake 1. Walking without water, a silent trigger for stroke. Most of the seniors I know are very proud to stay active. A walk every day isn't exercise, it's a habit, a lifestyle, a metaphor of discipline and independence. And it's correct, walking is good for your health. But what if I were to tell you that walking without water intake can subtly lay the foundation for a stroke during sleep? Here's why. As a neurologist, I've treated countless older adults who exercised regularly, ate well, and avoided smoking, yet still suffered strokes out of nowhere. They felt fine in the evening, but the next morning they woke up unable to speak, move, or worse, not at all. In several cases, there were no obvious warning signs, no clogged arteries, no heart arrhythmias. The underlying cause: dehydration. Subtle, often ignored, but extremely dangerous. With age, our perception of thirst disappears. That walk, which used to be invigorating at 50 years of age, can result in significant fluid loss at 70, even if it's only 20 or 30 minutes. Seniors lose fluid more rapidly. Their kidneys are less efficient filters. Blood gets thicker and more sluggish, tending to clot. And those clots often strike at night, when blood pressure drops and oxygen levels decrease, leaving the brain more vulnerable. Let me share the story of Mr. Jameson, a 79-year-old retired firefighter from Colorado Springs. He was in excellent shape, strong legs, clear eyes, mentally sharp. He walked 2 miles every afternoon, regardless of the weather, but he refused to carry water, said it made him feel like a tourist. For more than a year, he had walked every day in the dry mountain climate, without water beforehand or afterwards. One morning, his wife discovered him lying on the floor. His right side was paralyzed. He had had a severe stroke. There were no obstructions in his arteries, no indications of heart problems. But his lab work revealed thick blood and evidence of long-term mild dehydration. His stroke was probably the result of small clots, slowly developed over time due to multiple walks with inadequate hydration. What few people know is that even mild dehydration can thicken blood by over 10%. That's all it takes to cause circulation problems in the brain's smallest vessels. At night, when your body naturally reduces blood pressure and oxygen delivery, this makes for a perfect storm. Walking isn't about the distance you cover. It's about whether or not your blood is flowing freely to feed your brain after exercise. Without adequate fluid, walking becomes a stress factor, not a positive. And this danger doesn't only happen in the summer. Actually, winter strolls are even more perilous. Dry, cold air siphons moisture out of your skin and lungs, even if you don't feel parched. I've had patients have strokes in January after brief walks, without even realizing that the bracing air snuck up on them and dehydrated them. It's a silent danger, but one that is completely avoidable. Here's what I want to tell every older adult who's watching this. Before every walk, have 6 to 8 ounces of room temperature water. After your walk, have a glass. Don't wait until you are thirsty. By that time, dehydration has already set in. Take a small water bottle with you during your walk. If you experience dizziness, dry mouth, or feeling unusually fatigued afterward, these are subtle warning signs of dehydration. Don't disregard them. Mr. Jameson lived, but now walks with a cane and is no longer able to drive. When I went to visit him in rehab, he told me softly, "I thought I was doing all the right things. I didn't realize forgetting water would deprive me of my independence." I'm telling his story so that it doesn't end up becoming yours. And while dehydration may be a well-documented risk, the next error is one hardly anyone discusses, and it may be silently inflaming your brain vessels every time you go outside. Let's discuss. Mistake 2. Walking without sun protection, a hidden inflammatory threat. Sunlight feels wonderful. It lifts your mood, increases vitamin D, and brings joy. But for older adults, it can also carry an invisible danger. Most seniors enjoy walking under the open sky. It feels like freedom, but your skin and blood vessels aren't the same as they used to be. As you get older, your skin loses its defense layers. Your immune system takes a hit, and your blood vessels, particularly those that supply your brain, become weaker and more sensitive. The sun's ultraviolet, UV, radiation does more than damage your skin. It fires off stress signals down your entire vascular system. Even 20 minutes of unprotected exposure can cause oxidative stress, inflammation in blood vessel walls, and interference with blood flow. In older people with high blood pressure or hardened arteries, this is particularly hazardous. Inflammation accumulates gradually and unbeknownst. Arteries constrict and harden over time. Microclots are started. These clots won't be problematic immediately, but if even a single one migrates to the brain while one sleeps, it might clog an essential artery and lead to a stroke. I want to introduce you to Mrs. Elaine Madsen, a 76-year-old Arizona widow living in Tempe. Elaine Madsen was a nice lady who enjoyed taking her little terrier, Pepper, out for a walk every afternoon around sunset. She never gave it a second thought. She wore sandals, skipped the hat, and shunned sunglasses, said they made her look too dressed up. She thought her afternoon walks were healthy for her. But gradually, the readings of her blood pressure were erratic. She grew tired more frequently, dizzy occasionally, and even had hazy vision at times. She wrote it all off as symptoms of natural aging, until one morning early, her daughter discovered her lying on the kitchen floor. Her face was sagging on one side, and she couldn't utter a word. Elaine had experienced a left-sided ischemic stroke, the sort that steals away your speech. As we perused her medical records and labs, we saw no atrial fibrillation, no large plaque accumulation. But what we did see was troubling. Chronic inflammation of the endothelium, increased C-reactive protein, a major indicator of vascular stress, and unmistakable evidence of oxidative damage. I think her unprotected daily strolls in the blistering, dry sun had slowly inflamed the fine vessels in her brain. In due course, this caused clotting to occur and compromised the protective barrier between her blood and brain. Here's the thing that makes it so terrifying. Elaine didn't have any symptoms. She wasn't pushing herself, she wasn't smoking, and she didn't appear to be doing anything harmful. And yet she was quietly building an internal environment where a stroke could occur unnoticed overnight. So what could she have done differently? As we get older, we react to the sun in a completely different way. That same 15-minute walk that tanned you at age 40 can now irritate your blood vessels at age 70. And your eyes, they're a straight shot to the brain. UV light can harm the retinal arteries and optic nerves and place you at greater risk for vision loss as well as inflammation of the brain. That's why I now ask all my senior patients, if you get outside, even just for a 10-minute walk, cover up. Wear a brimmed hat that covers your face and your neck. Wear UV protection glasses that wrap around your eyes. Wear lightweight, long-sleeved shirts if the sun is intense. Stay out of the peak UV hours, generally between 10 a.m. and 4 p.m. This is not about vanity. It's about safeguarding your brain, your sight, and your independence. Elaine is in speech therapy these days. She's walking again, but with a cane, a broad hat, and good UV-rated glasses this time. "I had no idea the sun could hurt my brain," she said to me. "I used to think it just made your skin age." That ignorance cost her some of her independence. It doesn't have to cost you yours. If you've been walking without protection from the sun, particularly in hot, dry places, please take this seriously. Your mind recalls everything you do for it. and everything you don't. But if sunlight is such a sneaky menace, wait until you hear what can occur when you walk by yourself, and no one is available to see when something goes amiss. What if your next walk was the one in which your leg collapsed, and nobody noticed? Let's discuss one of the most lonely and most risky walking practices of all. Habit 3, walking alone, no one to spot the warning signs. There is something serene about walking alone. For many older adults, it is a quiet ritual, a time to think and enjoy nature and feel in control. You may not want conversation or company, and quite frankly, you have earned your solitude. But here's the hidden risk. Walking alone means no one is around to recognize when something is going wrong. As a neurologist, I've seen the consequences firsthand. Strokes and medical emergencies where early warning signs were missed simply because no one was there to notice them. Most strokes don't begin with someone collapsing. They often start subtly. A slight slurring of words, a few seconds of confusion, numbness in one arm or leg. It's easy to ignore those symptoms when you're alone. You just tell yourself maybe it's just because you're tired or off balance. Meanwhile, however, a small blood clot could already be interrupting oxygen to part of your brain. Let me tell you about Mr. Leonard Baines, a 75-year-old widower from Minnesota. He was fiercely independent and proud of it. "Doc, I've walked every day since my wife passed. Keeps me grounded," he said to me. Each morning he walked 2 miles around his neighborhood. No phone, no friend, just a jacket and a baseball cap. Then one chilly January morning, Leonard experienced what he referred to as a weird spell. He couldn't remember how he got there. His right leg felt weighed down, but no one was nearby, so he sat on a bench, waited a few moments, then completed his walk. The following morning, he awoke disoriented, with double vision and a throbbing headache. His daughter phoned 911. Leonard had experienced a cerebral embolism, a stroke brought on by a clot that migrated to his brain. That strange spell on the bench? A mini-stroke, a warning sign by his body that something was amiss. If someone had been accompanying him, they may have seen his confusion, his staggering walk, or his slurred words. They may have called for assistance before it was too late. But he was by himself, and the delay in treatment resulted in lasting damage. Leonard did recover ultimately, but he now has to talk slowly and has trouble with balance. "I wish someone had been there," he said to me afterwards, "just to say, 'Hey, Leonard, something's not right.'" And that's the thing. You don't walk alone because you're irresponsible. You walk alone because you're powerful. But real power is recognizing when to allow someone to assist you. Here's the truth. Much older people actually don't know they've experienced a stroke until days afterward. And if you don't get into the critical 3-4, 5-hour time frame for treating a stroke, the damage can become irreversible or fatal. So what can you do? Walk with someone, even once or twice a week. Help with a local senior walking group. Inform a neighbor of your route and report back afterward. At the very least, wear a phone or a medical alert device that can call for assistance and recognize falls. It may seem like a little thing, but it can make the difference between catching a stroke in time or never having the chance to. Leonard still walks, but now he walks with his daughter. They converse. They watch out for one another. He shared something with me that I will never forget. "Solitude is peaceful, Doc, but silence can be deadly." And he's right. You may be thinking, as long as I don't overeat or push myself too hard, I should be fine. But what if when you walk, particularly after a rich meal, could silently heighten your stroke risk? Let's continue. Habit 4, walking after a heavy dinner, bad timing, bad pressure. Taking a walk after dinner is nothing more than a healthy routine. Many older adults engage in the practice to settle their digestion, relax before sleep, or stabilize their blood sugar. But here is what most people don't know. When your evening walk happens too soon after a large meal, it can quietly step up your risk of a nighttime stroke. As a brain doctor, I've seen this more often than you'd expect, especially in seniors who have been following the same routine for years. You complete a warm, filling dinner, perhaps a bit more than normal, meat, mashed potatoes, some wine, and then you think, "I should go for a walk, get the blood flowing." But here's what most people don't know. That walk after dinner could potentially be endangering your brain. After a greasy meal, particularly one high in carbs or fats, your body redirects blood away from the brain to the digestive system. It's known as postprandial hyperemia and is a natural process. Your intestines and stomach require increased blood supply to digest the food you've consumed. In younger bodies, this redistribution occurs smoothly. But in older people, particularly those who have high blood pressure, diabetes, or rigid arteries, this redistribution can decrease the flow of blood to the brain at a crucial moment. Now introduce walking into that picture. Walking requires still more blood for your muscles, for bringing oxygen, for regulating your heart rate. But your body's already preoccupied with digestion. So where does it borrow that extra blood from? Too frequently, the brain is the silent donor. That's when the real hazard starts. Mild dizziness, sudden weakness, disorientation. In others, microblood clots occur because of slow-moving blood and constricted arteries. It's a subtle change, but significant enough to initiate a perilous chain reaction. You go to bed feeling full but content. But in the early morning hours, when your blood pressure naturally spikes during REM sleep, a clot formed hours earlier can suddenly block a delicate artery in the brain. That's exactly what happened to Mrs. Harriet Coulson, a 74-year-old retired piano teacher from Albany, New York. She was poised, elegant, and regular in her routines. She'd have dinner every night at 7 p.m. alone, something rich. Then, as reliably as a clock, she'd put on her coat and go for a quiet 20-minute stroll around the block. "I do it for digestion," she explained to me. "It keeps me light for sleep." But one day, her neighbor saw that her newspaper was still lying on the porch at 9 a.m., most un-Harriet. Paramedics discovered her alert but disoriented. She was unable to articulate words coherently. She had experienced a left hemisphere ischemic stroke, possibly early in the morning. Her scans revealed no atrial fibrillation, no large plaque, but something stuck out. Her blood pressure had risen extremely overnight, and her blood was anomalously thick. The suspected culprit, that evening routine. That walk, taken a mere 15 minutes after pork chops, spuds, and a slice of pie, had her body doing too many jobs at once. With digestion already requiring blood flow, and a walk requesting even more, her brain was left in the dust. When the stroke struck during sleep, there was no notice, no agony, just nothing. Harriet made it through. She's in speech therapy now. "I did what I thought was right," she said to me. "I didn't know getting up too soon after supper would steal my words." Her tale is sad, not because she was wrong, but because so many seniors are doing the same, oblivious to the danger. Yes, movement is healthy, but timing is everything. If you're 60 or older, here's what I advise. Wait a minimum of 90 minutes after a large meal to walk. Take short and gentle post-dinner walks. Don't walk briskly or go for an extended walk right after dinner. Instead, do light house chores, some gentle indoor stretching, or wait until morning for your longer walk. You don't have to abandon your walks, just synchronize them with what your body needs right now. Your brain will appreciate it. And don't forget, your brain is most susceptible at night, when blood pressure naturally increases during REM sleep. An earlier evening clot could remain unnoticed until it's fatal. Harriet walks again, but now she eats lightly, waits longer, and heeds her body. "I finally realized," she said, "my body isn't 40 anymore. It's not about doing more. It's about doing it wisely." And talking about wisdom, have you ever thought about how the manner in which you walk could be quietly cutting off your blood supply to your brain? Up next, the walking error that's right under your nose. Habit 5, poor posture walking, the unseen stroke risk most seniors overlook. Most seniors have great pride in their daily walks. It's their strength ritual for independence and health. But few know this: the way you walk is just as important as how frequently. It's not about speed, length, or high-tech equipment. It's about alignment. As we get older, gravity tugs a bit tighter, shoulders slump forward, the neck drops down, the eyes look at the ground, attempting to sidestep a fall. It's a seemingly smart habit, but one that can silently become fatal. That tilted head forward, that rounded spine, they squeeze the carotid arteries in your neck. These are the same arteries that supply oxygenated blood directly from your heart to your brain. If you habitually tilt your head forward or round your shoulders, You decrease the room in your cervical spine. You lower the amount of blood delivered to your brain. You enhance the probability of clot formation due to turbulence in constricted vessels. And here's the ominous part. If a clot forms near the base of the skull, it doesn't have far to travel. One misstep, one dislodged clot, one quiet night, and suddenly a stroke. Let me share the story of Mr. Albert Knox, a 78-year-old retired accountant from Illinois. He came to my clinic after experiencing a transient ischemic attack, TIA, a mini-stroke. The symptoms were short but terrifying. He had been on his morning walk when suddenly he felt dizzy. His vision was blurry. His left hand numbed. He couldn't get his words out. It lasted for a few minutes, but he suspected something was amiss. His tests were negative, no AFib, no high cholesterol. But when I asked him to walk me through how he walks, I spotted it right away. Albert's position was severely slouched, his head angled down at almost 45 degrees, his shoulders curved in. He reported walking that way since a fall 2 years previously, just to be safe. That self-protective mechanism, ironically, became in silent danger. We did a carotid ultrasound as he maintained his walking position. Sure enough, blood flow to the brain plummeted when his neck was flexed. His body had become accustomed to a compressed, forward-leaning gait, and each step was silently starving his brain of oxygen. That TIA, probably the result of a clot that had developed in one of those narrowed vessels, finally dislodging. Albert was fortunate, no permanent damage, but it was an eye-opener. I figured walking was good for me, he said. I had no idea the way I walked could be the thing to hurt me. We took action: posture correction, core strengthening, slight elevation of gaze, walking poles for alignment support. Today, Albert stands taller, steadier, and safer. His confidence has returned, and more importantly, so has his brain blood flow. So if you're over 65 and walking every day, ask yourself, where are your eyes looking, down at risk or ahead at life? Are you lifting your chest, relaxing your shoulders, keeping your neck straight? Here's what to do. Keep your chin up. Look 10-15 feet in front of you. Try using walking poles to assist with posture. Do balance exercises and stretches to maintain alignment. Walking is potent, but only if it enhances your circulation rather than constricts it. Since the brain relies on one thing more than anything else, oxygen. And if your posture is quietly usurping that from it, each step may be leading you further toward danger rather than well-being. Slowly bring your shoulders back. Visualize a string pulling up the crown of your head. Have trekking poles or a walking stick for support if you require it. Stretch your neck and upper back every day. Posture is muscle memory. It can be relearned. But don't wait for the warning signs. Don't wait until you feel dizzy, until you see your speech slur back at you in the mirror. By then, it may already be too late. Guard your brain now, not just by walking, but by walking correctly. Albert, the fellow I mentioned earlier, said something on his last visit to me that I have never forgotten. I figured a fall would be my greatest risk. It turned out to be how I was standing. And if something as little and mundane as posture can influence blood flow to your brain, just think about what your shoes are doing. If your shoes are too tight, too stiff, or totally flat, they can sneaky disrupt your balance, cut off blood flow, and juggle your blood pressure into a frenzy. Up next, Habit 6, wearing the wrong shoes. How bad shoes can ruin your circulation, multiply fall risk, and quietly prepare the way for stroke. Shoes are an automatic decision for most people, something you put on and ignore. But if you're over 65, the footwear you wear, their shape, their support, their soles, can be the difference between safeguarding your brain or unleashing a disastrous stroke. This isn't merely a matter of comfort. It's a matter of circulation, balance, blood pressure, and clot formation. As a neurologist, I've witnessed how something as ordinary as footwear becomes a silent health threat. With time, the inappropriate shoes don't only cause pain in your feet. They alter the way you walk. They alter your posture. They cut off blood flow from your lower legs to your heart. And gradually, quietly, they put you at risk for stroke. Not all at once. It accumulates step by step, until one day your body catches up with you. Here's the truth. As we get older, fat pads in the soles of our feet shrink. Arches collapse. Ankle joints become stiff. Shoes that used to be okay suddenly become painful, unbalanced, or worse, venous and nerve compression. That squeezing delays blood return from your legs to your heart. In individuals with varicose veins or vascular disease, this can result in clotting. They tend to be small, but occasionally they migrate. And once a clot arrives at the brain, the effect is rapid and permanent. A stroke, but it doesn't stop there. Shoes that are too tight, too flat, or too hard also change your gait. They shift your stride, alter knee angle, throw off your balance. To compensate, your posture slouches, hips tighten, and the strain shifts to your spine and neck. That chain reaction reduces oxygen flow to the brain and increases the risk of both instability and clot formation. Let me tell you about Mrs. Jeannie Rohr, a 72-year-old retired librarian from Maine. Jeannie was quick-witted, fit, and punctual, the kind of woman who color-coded her grocery list. She walked around the high school track each morning with her sister, but always in the same old slip-on canvas shoes. Fashionable, convenient, but with no arch support. "They're light," she said to me. "I don't like bulky sneakers." And then she began to feel tingling in her toes. A bit dizzy after walking. Her right foot collapsed one morning. She fell back, hit her head. At the ER, the scan showed a tiny cerebellar stroke due to a clot that had migrated to her brain. But the shocker was on her leg ultrasound. She had a deep vein thrombosis, DVT, clot in the lower vein of the leg. What caused it? Constricted blood return due to months of walking in shoes that collapsed her feet, restricted calf activation, provided no support, no heart issues, no atrial fibrillation, no significant cholesterol problems, just the wrong shoes. Shoes that altered her gait, impaired circulation, and triggered a domino effect that almost stole her independence. Today, Jeannie is walking once again, with orthopedic shoes fitted by an expert. She recently confided in me. "I never thought shoes could hurt my brain. I just thought they hurt my feet." And that's the trap so many older adults fall into. We disregard foot pain, slide on what's convenient, wait until they're wearing through. But here's the reality. Your feet are your foundation. And when they're not supported, knees, hips, spine, brain all suffer. Here's what I advise all my senior patients. Select shoes with good arch support and shock-absorbing soles. Ensure there's enough room in the toe box. Your toes should never be squished. Steer clear of totally flat shoes. Your foot requires slight lift for good circulation. Have your gait and foot shape tested every 1-2 years by a physical therapist or podiatrist. Never wear shoes with flat soles or that feel off-center on level surfaces. You don't have to spend hundreds. You need shoes that support your stride, protect your vessels, restore your balance. Because one misstep, one unnotified ankle twist, or one clot from a compressed vein is all it takes to change everything. Footwear may be a small decision, but oftentimes it's the little things that have the biggest impact. In talking about habits, tell me this. What if the ground you're walking on, the slopes, the broken sidewalks, the inclining driveways, is quietly exposing your brain to danger on a daily basis? Next up, Habit 7, walking on steep or uneven surfaces. How those familiar neighborhood strolls might be causing deadly blood pressure spikes, strain on the heart, sneaky risk of stroke. Stick with me. Habit 7 could be lurking right beneath your feet. Let me tell you about Mr. Raymond Ellis, an 81-year-old former city inspector from Pennsylvania. A proud man who stayed active, Raymond walked the same forest trail near his home every day. Winding through gentle hills, loose gravel, and the occasional tree root, that trail was his sanctuary. "It keeps me young," he'd always say. He walked with a cane, maintained a steady rhythm, and refused to use sidewalks. "They're too easy," he'd chuckle. But one morning after a rainy night, he slipped slightly on a muddy slope. He didn't fall, but his heart suddenly raced, his head began to spin, and he had to sit down. By the time his neighbor found him at home hours later, he was slurring his words and completely disoriented. Raymond had suffered a stroke, a right parietal stroke that affected both his memory and balance. When we examined his case, the cause became painfully clear. His blood pressure had surged dangerously during that walk. Imaging revealed microclots in his brain's blood vessels, likely triggered by a perfect storm, uneven terrain, vascular stress, and mild dehydration. The very hills he believed were keeping him strong had silently pushed his cardiovascular system past its limits. And Raymond's story is not unique. As we age, the baroreceptors, sensors that help regulate blood pressure, become less responsive. Your body doesn't adapt as quickly to sudden exertion or elevation changes. Even a small hill can spike your blood pressure by 30 to 40 points for several minutes. And if you already have plaque buildup or narrowed vessels, that spike can cause clots to form or break loose. But don't get me wrong, this doesn't mean you should stop walking. It means you need to start walking smart. If you're over 65, avoid steep hills or sharp elevation changes, unless your doctor has cleared you. Choose flat paved walking surfaces, like school tracks, smooth sidewalks, or indoor malls. Wear shoes with ankle support and strong grip, especially if walking in wooded or uneven areas. Take regular pauses, let your heart and brain reset. Always carry water, never push through fatigue or dizziness. Today, Raymond still walks, but he walks the local track now with a friend, with intention, and with awareness. "I didn't lose my independence," he told me, "but I learned not to gamble with it." Because the surfaces we walk on may look familiar, but our bodies aren't the same. They don't adapt in silence anymore, they whisper. And if we ignore those whispers, one day, they may stop altogether. But here's something even more surprising. It's not just the ground beneath your feet that can put your brain at risk. It's what's going on in your mind while you walk. Coming up next, Habit 8, walking while distracted. How checking your phone, zoning out, or even daydreaming could be silently sabotaging your brain's balance systems and increasing your risk of stroke. Don't miss it. The most dangerous moments might be the ones when you're not paying attention. Donna's tale is a difficult one, but she tells it with unobtrusive strength. "I used to walk to run from my thoughts," she said. "Now I walk to hear them." Her advice is a reminder that walking can be calming, but also misleading. Because even when your schedule feels serene and in perfect harmony, there's yet another habit, one of the most surprising of all, that can quietly jeopardize your brain. Habit 9, walking too late at night and spiking nighttime blood pressure. On the surface, it sounds innocent, even wholesome. A leisurely evening walk, starlight, the sun is down, the breeze is crisp, and the world has finally grown quiet. For most elderly, it feels like the most secure, soothing part of the day. But here's the reality. That well-meant walk is potentially secretly laying the groundwork for a stroke during your sleep. Why? Because your body no longer reacts the same way to nighttime activity. Let's take a peek inside. Between 2:00 a.m. and 4:00 a.m., your brain and heart access their most vulnerable window. This is when your blood pressure normally spikes during REM sleep, a transition regulated by your hormones and internal clock. In young adults, this surge is cushioned by robust vascular tone and fluid balance. But for older adults, particularly for those with rigid arteries or a history of high blood pressure, that natural spike is a silent killer. Now consider adding to that vulnerability a walk later at night, one that occurs only an hour before retiring. Here's what most people do not know. Exercise activates your sympathetic nervous system, the same system that raises your heart rate, boosts adrenaline, and keeps your body alert. After a late walk, your body remains stimulated. Your heart beats faster. Your blood vessels stay constricted. Your brain remains on high alert. This overstimulation not only makes you struggle with sleep, it keeps your system switched on for the very hours it needs to be shutting down. And this imbalance can sneakily trigger a stroke during your slumber. I will never forget one individual, Mr. Dennis Monroe, age 80, a retired South Carolina veteran, keen mind, sweet heart. He paced each evening at 8 p.m., sometimes later. It aids digestion, he'd explain, and I enjoy gazing at the stars. Dennis thought his habit was keeping him sleeping, and partly it was, but not as he wished. One morning, Dennis didn't wake up at 6 a.m. as he normally did. His wife discovered him in bed, breathing shallowly, the right side of his face loose. He had endured a large ischemic stroke sometime in the early hours. Imaging showed a clot in the posterior cerebral artery, impairing his vision and equilibrium. His blood pressure had risen to 190/110 at 3:15 a.m. No heart disease, no smoking, under control cholesterol, but his evening strolls, soft as they were, had pushed his old body beyond the limit. His condition was indicative of something called autonomic dysregulation, when your nervous system can't return to its normal state after being stimulated, resulting in nighttime hypertension and clotting. Dennis survived, but he never became the same again. He has to walk with support now. He can't drive. And the toughest part? He did everything correctly, except nobody informed him what time not to walk. That's why I'm sharing his story, and Donna's, and Margaret's, because many older adults are doing the right things but with incorrect information. Their bodies have transformed, yet nobody notified them that rules have been changed too. So here is what I need each senior who is watching to remember. Your body is different now from the way it was at 40. Everything counts now: the time you walk, the surface you're walking on, your shoes, your drinking, your awareness. The walk itself is not the risk, walking unaware is. These nighttime strolls can create clots. They can increase your blood pressure when it should decrease. They can narrow already clogged arteries. And the bad news, they do it silently. Until morning you don't wake up the same. So what should you do? Walk, absolutely, but walk smart. Choose mornings or early afternoons when your system is alert and stable. Walk on flat, familiar surfaces where your body can focus on movement, not reaction. Walk with friends, with water, with intention. You're not too old to move, but you're far too wise now to walk without understanding what your body is telling you. One last story. Margaret Hill, 84, from Iowa. After recovering from a mini stroke likely triggered by a cold, late walk, she told me something I'll never forget. I was walking toward health, but in the wrong direction. So let's turn that direction around together. Let's take a step with knowledge, with intention, and with the ability to safeguard our brain, our balance, and our independence, a wise step at a time. Now it's your turn. What is one thing you learned in this video that you'll use in your own life? Share it in the comments below. Let's help each other on this journey. If you benefited from this, type 1 in the comments. Otherwise, type 0. Your candid feed is what helps us grow. And don't forget to like, share, and subscribe for more science-driven insights into older adult health and well-being. Thanks for watching. Here's to walking forward, not just longer but wiser and stronger.